Hi, my name is Lindsay Putker. I am an RN at St. Joseph's Hospital Highland, and the purpose of my presentation was to talk about physical inactivity. The population that I chose were adults in Madison County. Most of the people that I did present to were healthcare workers. So I do feel like that is something that I could have done better in my presentation. I just focused on the adults in this area, but I feel like since I was doing it to healthcare workers, I could have put more interventions towards that. The reason that I picked physical inactivity was because in the county health rankings, physical inactivity and obesity were higher in Madison County than it is the state and national average. And this is also something that I struggle with, to get enough physical activity, so it was also a personal thing as well. I did my presentation by using a PowerPoint, so I printed out the PowerPoint as handouts also for them to be able to follow through and keep afterwards. And then I also put my objectives in a quiz format at the end to see if they could come up with my objectives. My objectives were that they could identify 3 ways to improve physical activity in our community. The other one was to find 3 health risk factors that physical inactivity causes, and then 2 ways that we can increase our physical inactivity on our own. So in the literature, I had started with some statistics, such as 300,000 deaths in the US per year can be linked back to physical inactivity. I also talked about the health risk factors that physical inactivity can cause, including stroke, cancer, high cholesterol, obesity, and also mental health risk factors such as depression and negative coping mechanisms. Also in the literature, I found how physical activity has decreased over the years. So actually, I was able to find statistics on how now we have much lower activity jobs. We're sitting more at desks. Also, kids aren't walking or riding their bikes to school anymore, things like that. I was able to find statistics through the years. Also, through the review of literature, I came up with some interventions. I split them into individual and community interventions. So some individual interventions were trying to walk to different places or ride your bike instead of using your car, going to local exercise facilities, having a support system and creating a support system, because I did also find that with support it was much easier to get more physical activity. With the community interventions, the biggest things were making sure that the population has access to do activity such as bike trails, sidewalks that are actually accessible that you can ride your bike on or that are safe, and just bringing more awareness and more policy towards it. So another intervention for an individual would be that you could join in on some of those policy making, being on committees and things like that that would increase physical activity. So my PowerPoint went through the objectives, the statistics. I also included the county health rankings of why I felt that this was important. Also, I went through the cardiac rehab program that we have at our hospital and most hospitals have across the country, that offer exercise regimens to those people that already have heart disease or are already at high risk because of physical inactivity or obesity or any heart-related issue. Also, I talked about barriers to physical activity, such as the cost of exercise programs, a lack of self-esteem, even not wanting to go to the gym. Technology, now we have technology that's able to do everything for us. And then time. Most people have so many other things in their lives that they can't find time to do exercise. I also talked about activity that we already have in our community, such as rec centers, other exercise facilities, bike trails, walking trails, the parks that we have. And overall, I felt like what worked well was that I was comfortable in front of the people that I was talking with because they were healthcare workers, and I feel like everything was very, I felt like people were very engaged with what I was talking about because I felt like a lot of people in there could relate to what I was talking about. But like I did state earlier, I do feel like I wish I would have focused on some nursing interventions or even medical interventions that I could have included since they were healthcare workers. So that would be what I would change if I were to do the presentation again. And my takeaway from this whole class experience is just to look more at the broader picture. Actually, by looking at our population, you can directly correlate that to the patients that you're seeing and how you're taking care of them. So I feel like that's the biggest thing that I've been able to take away from it. And thank you.